Hi everyone, this is Dr. Cole Handy Jones here with your handy physical therapy tip of the day. Today I'm going to be talking about hip arthritis, and specifically what hip arthritis causes older adults to lose out on and struggle with, and then what you can do to get it better, because this is a condition absolutely treatable with physical therapy and the right routine of stretches and exercises. So let's get started. If you've been following along with my arthritis series, you've seen me explain that arthritis doesn't need to be fixed with surgery. You can fix it without that. And that arthritis is really one of the leading causes of disability in older adults. It causes pain, swelling, decreased function, and disfigurement, and things that cause older adults to kind of socially isolate and keep themselves from going outdoors and being normal human beings. And the more that we stop doing those activities, the worse we tend to get. So it's kind of this vicious cycle that keeps taking us downwards. One thing that I found as I was researching this was one article that talked about what are the most common things that older adults have when they have arthritis and what are some of the symptoms or byproducts. And here's a little bit of that. It says that people with arthritis struggle with functional limitations, meaning walking, standing, a loss of flexibility. It also leads to sleep disturbance. If you have arthritis, pain and swelling, you're not going to sleep as well. It leads to fatigue. It leads to a grating or kind of a bone-on-bone sensation as you move and walk, which sometimes can be troublesome to people. It leads to joint swelling, disfigurement, and then sometimes can lead to numbness and instability. Oftentimes, the first line defense for arthritis is medication and surgery. First and foremost with medication, we know that we're in the middle of an opioid epidemic, so we need to be really careful with that. There's a time and a place, but if we become totally reliant on that, that's not a good thing. And we also know that medication is not fixing the problem at all. It is merely masking it while the condition will continue to get worse. The next option is surgery. Now, people with total hip replacements do well, but we should never jump to that conclusion because we know that surgeries cannot be undone. So we should really exhaust every conservative mean that we can first before we consider a surgery. If you've been in and seen your primary care physician and told them you have hip pain and they do an x-ray and they tell you that it has arthritis, that might be true, but we always want to match an x-ray with some sort of a functional exam, okay? X-rays can be somewhat tricky and they don't give us the whole picture. We have to match that x-ray with a functional exam to really know that your hip arthritis is what's causing all of your pain in that hip. Sometimes it's not. It might be something coming from the back or something else. Common signs and symptoms that I see in people with hip arthritis is, first of all, if you're over 50 years old. If you're a little older, you probably have a better chance of having some form of arthritis, mainly hip arthritis. Another one, if you have morning stiffness. What that means is first thing in the morning when you wake up and get out of bed, your hip feels extra sore and stiff. It doesn't want to move very well. But after about 30 minutes to maybe an hour of movement, it actually starts to loosen up and feel a little bit better. Two other signs that I normally see is loss of motion, specifically in hip flexion and hip internal rotation. That tends to be painful. So a couple simple tests that you can do. You can take your hip, grab it, and pull it to your chest. If you do that and it doesn't go very far and it's painful, it might be hip arthritis. Another thing that you might try is taking your knee and pulling it up and across your chest, okay? That tends to bias it a little more in internal rotation. And if that's limited and especially painful, that might be a sign of hip arthritis. There are 5 main ways that physical therapy can help with arthritis. The first one is range of motion, strength, posture, balance, and then it can fix the underlying cause or the why of you even have arthritis. I did a whole video on that, so I won't go into more series. So click right here on this link to go to that video right now. So now I want to show you 2 stretches and 2 exercises that can start to help you treat your hip arthritis. It's going to be focused on range of motion and it's going to be focused on strength. So the first thing you can do is a self-assessment. So if you grab your knee and pull it up towards your chest, you'll probably notice that you're pretty limited and painful. So for example, a normal person, my hip isn't arthritic, I can pull it pretty far up here. The normal is about 120 degrees without any pain, okay? If you have arthritis, especially severe arthritis, you might be back here about 90 degrees, maybe a little more, but it's probably gonna be pretty painful to pull up here as well, okay? The next thing you can try, especially if you pull your knee up and across towards the opposite shoulder, if I pull it across my body,
it's going to be even more painful and more limited because now I'm pulling it a little bit into internal rotation, which is a really closed position for the hip, and arthritis doesn't like that. Okay. One other thing you can try, just sitting here like this, is if you take your knees and let them fall inwards. So for example, if my left hip is the one I think might have arthritis, if I let this hip just fall inwards, it's probably going to be really limited and especially really painful, because one thing, and this is taking my hip into internal rotation, so you probably won't be able to do that. So give those few self-assessments a try to kind of help determine if you do have arthritis or not. The first two exercises that I want you to do are range of motion or flexibility exercises. Arthritic joints get stiff, so we want to get them moving again, okay? So the first thing I want you to do, lay down on your back, bend your knees up, okay? You're going to take your feet and put them nice and wide, okay? So I usually say wider than shoulder width if you can, okay? Then ever so slightly let both of your knees fall in one direction. So I'm going to let both my knees fall down this way. Let it go as far as you can without pain. When you get to that barrier point, whether it be pain or just a tightness, hang there for a second or two, and then you're going to go the other way. So say I'm going to go the other way, let my hips go as far as they can until I start to feel either pain or stiffness stop me. Hold for a second or two, and then I'm going to go back the other way, okay? And we're just going to let it go back and forth, okay? What we're doing is we're taking these hips now, and we're working them in both internal and external rotation, okay? The most limited one is probably going to be when your knee falls across midline. So for example, if it's my left hip that has the issue, if I fall across midline this way inwards, it's probably going to be the most painful and limited on me, okay? But we're just trying to milk back that motion ever so slightly in those hips, okay? But this one's going to be a home run one for you in the long run. Just be careful. Don't push too much through pain. Just kind of slowly work back that motion, okay? The next thing that you're going to try to do, laying on your back, I want you to try to take your arthritic hip. So once again, this is going to be my left hip. I'm going to try to cross my ankle on the top of my knee, okay? While it's crossed, this in and of itself might be pretty uncomfortable, okay? But what you're going to do is you're going to work your hip outwards and inwards. So I'm going to take my hand, I'm going to push away on my knee, just ever so slightly, pressure on, okay, until I feel a little bit of tensiony tightness. Hold for a second or two, and then I'm going to let go, and then I'm going to pull it the other way, okay? Then I'm going to pull across my body ever so slightly until I feel a little bit of tensiony, stretchy. Hold for a second or two, then I'm going to relax, okay? And I'm just going to keep going back and forth, okay? So once again, I'm working my hip in external rotation and in internal rotation, okay? One of the big differences between this one and the last one we did, this one gets a little more soft tissue stretch, whereas the other one gets a little more of a joint stretch, okay? We want to work both, okay? If we're talking arthritis, we especially want to work joint mobility, but a little bit of soft tissue mobility is a good thing as well. Okay, I'm just going to go back and forth. Same thing, don't push too much through pain, just a little bit, and then come out of it, okay? Those first two are range of motion or mobility exercise, okay? The more mobile your hip is, the better you are going to feel and the better you are going to function. The next two exercises that I want to show you are strengthening exercises. The better we strengthen our joint, the less grinding, friction, and discomfort we will have, and the better we're going to function. Okay, so exercise number one is a bridge. I bet you've seen this one before, okay? It's a really popular exercise. Laying down on your back with your knees bent underneath you, or excuse me, feet underneath you, and your knees bent up. You're going to squeeze your butt cheeks together and just try to lift your butt up off the ground, and then come back down. Squeeze your butt cheeks and lift the butt up and down. For this one, I'm not too concerned where your feet are at. I usually say about shoulder width apart is about right, but it doesn't really matter, okay? Our butt and our hip muscles are the biggest muscles we have in the body, okay? And this butt muscle is one of the biggest things that controls our hip joint. So if we can control it a lot better, it will lead to a lot less of that grinding, frictiony, and discomfort type of pain. But also help you function better. This will help you get on and off chairs, up and down stairs, and just different things like that, okay? So I want you to do a bridge, okay? Now if you try this the first time and try to go all the way up and you can't do it, or if it's really painful, back off, okay? All you have to do really is lift your butt cheeks up an inch off the ground and then back down to start with, okay? And then as you get better, go higher and higher. That's exercise number one. The next exercise that I want to show you is called a clamshell. So for this one, you're going to lay on your side with your arthritic hip up. So for me, for example, again, it's my left hip, so my left hip is on top, okay? I want you to line up this exercise with your ankles, your hips, and your shoulders all in a line, almost as if there's a wall behind you with your knees bent to about 90 degrees, okay? I really want you to focus with this exercise, keeping your hips stacked on top of each other, okay? That's probably the most important piece of this, okay? While keeping the hips stacked on top of each other, I'm gonna take my knees, spread them apart like a clamshell, and then bring them back together. Take the knee up, spread them apart like a clamshell, and back together, okay? What I do not want you to do is when you lift your knee up, also let your hips roll back, okay? That's probably one of the most common things that I see, and that's gonna start working other muscles and not really target our hip, okay? So what I want you to do, take your knee as high as you can, but do not let your hips roll back. Keep your hips stacked. So for me, sometimes I even take this hand and kind of push my hip forward, or I kind of put this forearm down. That means I know that I'm rolling forward, okay? But appreciate how much less my knee goes up when I do this, okay? But that means that I'm doing it right, okay? And you're gonna rep this. I usually tell people this should be a good workout burn here in the hip and back into the butt, okay? This is usually one of the weakest muscles that I find in people with hip arthritis, but it's really crucial to controlling the hip joint well, okay? Which once again, will help with pain and function. And same thing, if you can't go as high because of pain, just go a little bit and back together, okay? And slowly inch your way upwards as you start to feel better. So those are the 2 strengthening exercises that we're gonna start working on.
If you found something that was helpful in this video, please give the video a thumbs up, put a comment down below with a question, and subscribe to the videos. I'm gonna keep going with some more arthritis type videos in the future. I'd love to hear your feedback or any topics that you want me to address. So keep getting better, and I look forward to giving out more content soon. So my question of the day, what's your favorite movie? Please leave any questions or comments below, and I'll respond as quickly as I can.